Well, Nat, it looks like it is 7 p.m. I know that we will have lots of people that still feed in.
Right.
So, you want to
Let's
get started?
let's get started. Dr. Villa, are you ready to get started?
I'm ready. Thank
I
you.
love it. All
All
right.
right. Well, great. Well, I am JJ Elliott Hill.
And I am Natalie Elliott Handy, and we are the sisters with Confessions of a Reluctant Caregiver, and we are thrilled to have everybody come back for session 2.
Absolutely. We'd like to welcome everyone to the impact of dental health on preventing future medical complications. Now, this 6-part series is sponsored by Aquarel Protective Oral Spray and Philips. Tonight, we'd like to thank the Oral Cancer Foundation for their sponsorship of this session. And tonight, we have Dr. Alessandro Villa. And sorry, I had something pop up there. Dr. Alessandro Villa, and he is the chief of oral medicine and oncology and dentistry at the Miami Cancer Institute.
Well, and honestly, Dr. Villa, we are so thrilled to have you with us. I know that you're going to be talking about the influence of medical treatments on dental health, but specifically a little bit of a deeper dive into the challenges for cancer patients. And so before we get started, there's a couple of housekeeping things that I want to make sure that we do. I have my sassy glasses on to make sure I can actually read. So as normal, we were practicing putting where you were from in the chat so you could practice that. Make sure in the chat, this is how we'll do our questions. So make sure the button says everyone, not just host and panelists, because that allows everyone to see your question. So feel free to do that. If we run out of time, we'll make sure to send the questions over to Dr. Villa and we'll get the information back out to the group as a whole. We're also, again, like we stated last time, we have continuing education credits for dental professionals, RN, social workers, and speech and language therapists. And so we want to make sure, though, it's attending all 6 sessions. So if you miss one, you can watch it on YouTube. We've got the link that we send out with the thank you email, which you will receive tomorrow. And that will have the survey. It has all the CE information, has everything that you need in it. And it tells about next Tuesday's session as well. So without further ado, Dr. Villa, we are so excited to have you, like I said, and we're going to jump right in. And so in the last session, we talked a little bit higher level and we talked about xerostomia, which is the first time I had really ever heard of the formal diagnosis name, because I think of dry mouth. So I know we have new people that jumped in on this session. So would you mind to go over xerostomia and a little bit about that and how frequent that it is specifically around head and neck cancer patients?
Absolutely. And thanks for having me. And good evening and good morning, everyone. I see we have an international crowd, so I'm very excited about that. So xerostomia is what we define as the subjective feeling of dryness. So our patients may have plenty of saliva in the mouth, but yet feel that the mucosa is dry, or have no saliva at all and still feel that the inside of the mouth is dry. And unfortunately, some degree of xerostomia affects about 80% of patients who receive radiation therapy for head and neck cancer. I know the focus today is head and neck cancer, but this is a complication that we see in patients undergoing treatment for other cancers, such as patients undergoing bone marrow transplant who receive high or moderate doses of chemotherapy. These can also lead to less amount of saliva and therefore xerostomia. But I would say in patients receiving radiation for a mouth cancer or a head and neck cancer, this is unfortunately a very common mouth complication.
Mm. Mm.
So I'll ask, as far as this being a complication, what are the possible side effects of the dry mouth, of the xerostomia?
Yeah, that's a great question. Unfortunately, it becomes almost like a vicious cycle. Patients with persistent dry mouth can experience dental cavities. Saliva is really what protects the mouth from cavities and also help patients speaking. It helps us swallow. It helps us taste food. So taste can also be affected with dry mouth from radiation therapy. So I would say dental caries. So that's why oral hygiene is so important in patients with dry mouth, and seeing the dentist and the dental hygienist on a regular basis is really what what prevents patients from getting cavities. So prevention for dental caries. Patients with dry mouth are also more prone to develop oral infections, in particular yeast infection called oral candidiasis. This is usually treated with topical treatment with some antifungals, but some patients may require even systemic therapy to treat these complications from dry mouth. And I talked about taste. Taste is also affected. If we don't have saliva, we can't taste properly food. We may experience a different type of taste in the mouth. Oftentimes, patients report a metallic taste following dry mouth from radiation therapy, or patients may not be able to taste the food the way they were used to. So there's different types of taste changes. One is we taste less. The second one is that the food tastes different. So there is a variety of side effects that a dry mouth comes with. So not only there's dry mouth, but then dry mouth itself can cause all of these side effects that I just mentioned.
So it's not what I find intriguing here is that when you talk about the yeast infection, that really has nothing to do with the cancer or the disease that they're experiencing. That is just something because of dry mouth and this symptom itself. That's what causes these additional illnesses.
That's right, JJ. Yes, it's really secondary to the dry mouth itself.
Yeah.
So the radiation or some chemotherapeutic agents may cause dry mouth, and when it persists and when patients have little saliva, ultimately they're also at a higher risk of developing what we call candidiasis, which is this yeast infection.
Yeah.
When we look at the numbers, I'm an epidemiologist. I like numbers. When we look at the data, about 1 out of 9 patients with dry mouth will develop oral candidiasis. So it's actually relatively frequent when we look at yeast infections.
Yeah.
I had a question from Janice, and it said, can dry mouth be a factor in, I don't want to butcher this, but I'm from the South, oral lichen planus?
Lichen planus.
Thank
There
you.
you go.
Yeah, that's a great question, Janice. Lichen planus, it's a not immune disease that can affect the mouth, the skin, and also the genital area. When it does affect the mouth, some patients may experience xerostomia, which is again this subjective feeling of dryness. This is lichen planus is not related to cancer, but it is considered a pre-cancer of the mouth in some studies, and the risk of developing mouth cancer is about less than 1% in patients with lichen planus. But yes, dry mouth can be present in patients with lichen planus.
Wow. So I heard right off the bat, and everyone I think we're going to talk to talks about prevention. So tell me how you treat dry mouth, though. If you've got this issue, what are some of the steps? Because I think that's really what a lot of people are looking for.
Yeah, definitely. Again, this is a very common complications, unfortunately, for patients undergoing radiation therapy. And the guidelines for the management of xerostomia that we all follow as oral medicine specialists and other doctors that can help with dry mouth were published in 2021 on the Journal of Clinical Oncology, just to give you a little bit of historical background. And there are 2 ways to manage dry mouth. One is with pharmacologic treatment, so with medications, and the other one with non-pharmacologic intervention. So there's a variety of topical lubricants or saliva substitutes that are agents that are specifically directed to moisturize the inside of the mouth. And these are usually can be offered as an option to improve xerostomia that it's induced either by chemotherapy or by radiation therapy for head and neck cancer. Are also some gustatory or masticatory stimulation. So the mechanical stimulation can induce the production of saliva. This can be done by chewing a sugar-free gums, using sugar-free lozenges or sugar-free candies. And again, all of these provide a temporary relief in the mouth. There's really a laundry list of products available. And then, as I mentioned, there's also pharmacological treatment, so medications that we can prescribe And there are two in particular available, at least in the United States. One is called cevimeline, and the other one is called pilocarpine. And these can be offered in patients with dry mouth following radiation therapy, in patients who underwent treatment for head and neck cancers. And again, these medications can provide some temporary relief. And in a nutshell, what they do, they tell the salivary glands to produce more saliva. When a patient undergo radiation, some of the glands that are responsible at producing saliva are destroyed and they lose function. They're not able to produce as much as we can. And so we can try to use those glands that are still working, and these medications act on those glands to, again, stimulate the production of additional saliva. And in summary, we talked about moisturizers. These are over the counter. We talked about some prescription medications, but there are also studies looking at the role of acupuncture or electrostimulation of the glands. And these are also options that can be offered in patients with dryness following radiation therapy.
Yeah, and will you repeat the two? There's a question real quick. Will you repeat the two medications? The I'm really not a
Oh,
doctor. I'm a
absolutely.
social
Yeah,
worker, by the
absolutely.
way.
And I'm happy to put it in the chat as well.
That would
be
be
awesome.
great.
Look at
One
everybody,
is
we're
called
like, yes.
One is called pilocarpine. The other one is cevimeline. I apologize for some of our attendees from other countries. They might not be available in every country, but these are available in North America and in some European countries and Australia. And there is a third one that is not widely used, that it's called bethanocol. That can be another kind of off-label option, but the guidelines recommend the two that I mentioned.
Okay, it makes sense. And Candidus, is that right? When
Candida, yeah.
Thank you. Just go ahead, people. You can feel free to laugh at me. But so there's a question in here about, is that when the tongue is white or is it white coated? I had a question
That's
there.
a great question. Thanks for that question. So Candida in the mouth can present in different ways, but the most common is what we call, the fancy term is pseudomembranous candidiasis. What does it mean? That patients can develop multiple spots, usually everywhere in the mouth, not just the tongue, but it can also affect only one spot, that easily rub off with a little piece of gauze. So if you kind of like scrape it, it should go away. When the top of the tongue is white, that doesn't necessarily mean that it's a candida infection. That can happen especially when the mouth is dry. The tongue can look a little white when patients are not eating solid food. So we see that a lot in patients who are hospitalized, that can only have a liquid diet, because there's no mechanical friction on the top of the tongue. So as a reaction, the tongue gets a little whiter or a little yellowish, depending on the times. Most of the time, that's not a candida infection, but it's often misdiagnosed as a candida infection. It's what we call coated tongue or hairy tongue, because it kind of looks like little hair, if it makes sense.
I like that, the hairy tongue. I think that's like normal people. Now you got some diagnosis that I can actually, or I can name, which is
symptoms,
fun.
exactly.
Symptoms, thank you.
Yes.
So I want to ask this question. I see your question, Melinda. I'll get to you over there. What should a patient expect short-term and long-term, like whether it's soon after surgery or treatments, and then once you're in remission? Because my husband is an HPV head and neck cancer in recovery. He's 2 years post-treatment, and we have all the problems with saliva and very, very poor taste. So go into that a little bit more about during active treatment and then post.
Yeah, and thanks for sharing about your husband. When a patient undergoes radiation therapy for head and neck cancer, there's a variety of complications that can affect the mouth. Dry mouth is very common. There's also many others. When we focus on dry mouth itself, typically during the first couple of weeks of treatment, we start seeing a decrease in the amount of saliva, and then this decrease continues. Patients usually receive radiation for up to 7 weeks, depending on the different type of head and neck cancers or protocols, but that's a general rule, 6 to 7 weeks. So it starts after 2 weeks, and then it kind of gets worse over time. So in the short term, there is a reduction of saliva, which can lead to some of the complications that we described. So taste changes, and the radiation itself can also cause taste changes. So there's almost two risk factors: dry mouth and radiation, both together can lead to taste changes in patients. And then later on, we talked about infection, candidiasis. We heard this term many times tonight. And then if patients continue to have dry mouth and not enough saliva, they are at a higher risk of developing dental problems. And these are usually fast-growing dental caries that can develop relatively fast. So it's really important to make sure that every patient's scheduled to receive radiation therapy, see a dentist before starting therapy. It's important to always use a fluoridated toothpaste to prevent cavities and to protect teeth during treatment and after treatment. And I would say this is for the rest of their lives. A prescription fluoridated toothpaste is really recommended in cases of dry mouth following radiation therapy. And so a strict follow-up with a dentist, a dental specialist. There's oral medicine providers like us that our expertise is really managing some of these complications, including dry mouth. So the taste tend to improve over time. It can improve. It takes sometimes 2-3 years. But if there is dry mouth, then the first step is to treat the dryness, because as I mentioned, if no saliva, it means little to no taste.
So let me ask you this, because this is not one of your questions, but this is a good question. So one dentist told us trays for fluoride treatments at night, and another dentist gave us from where we had his treatments up north was you're good to use the fluoride toothpaste, the prescription toothpaste. Do you have a preference, one versus the other? I mean,
thanks for the question. Yeah. They're both right, meaning that I'm a big data guy, as I mentioned. When we look at the studies comparing the efficacy of brushing the teeth after each meal with a prescription fluoride toothpaste versus wearing a little stent that protects the teeth with fluoride gel for about 30 minutes up to an hour at nighttime, the efficacy is the same. So as long as patients brush their teeth, if it's easier to do that, it's totally fine. They still protect the teeth once patients brush after every meal with a fluoridated toothpaste. And this is a prescription toothpaste, so it has a little bit more fluoride than what you can find over the counter. But great questions. They're both valid options.
Okay.
We had a question from Melinda, and it actually really, I think, applies to that shorter term and longer term, what happens. So she had radiation for metastatic thyroid cancer, has had excellent, she says, dental hygiene for 14 years, but she's 73 now, and she's lost 2 teeth. Does aging have an impact on her dental care, on her dental health right now?
Thanks for the question, Melinda. It's a very specific question, and I don't think I have all the information to answer, but I'll try to give you a general answer. The fact that you also have lichen planus pose you at risk of having dry mouth, and then you had already metastatic thyroid cancer, and the therapy, I'm assuming, led to poor salivation in general. I would say it's hard to tell just because it's 2 specific teeth, but you do have multiple risk factors. You have the lichen planus that can lead to poor salivation. You had treatment for cancer that also cause poor salivation. My suggestion is try and make sure that you always brush your teeth with a prescription fluoride toothpaste, and see the dentist and your dental hygienist at least 3-4 times a year.
Oh,
Yeah, I was getting ready to ask about increased frequency. I know that what she had also said is she was really just trying to avoid more tooth loss, and she's using
Of
biotin
course.
water, massage to other because she also burned up those salivary glands, and so I think that's where she was looking for like anything else that she can do to try to avoid tooth loss because. I mean, I know when you, especially if you have any type of radiation to your mouth, it makes it a lot harder. That was the big risk factors that our dentist told us up north was you really want to brush because you don't want to have future dental work because it's harder for that jawbone and that area to circulate blood. And I really did listen. And so it was like, oh, we don't want, so he is brushing his teeth all the time. And almost to the point that our local dentist got concerned that his gums are starting to recede from almost, I think it's brushing too hard. Any advice? Does it have to be after every meal or any thoughts like that?
Yeah, in general, because of the absence of saliva, we typically have 3 meals a day. So
Mhm.
brushing at least twice a day, but because that's the recommendation in the general population. But
yeah.
if there is dry mouth, not only the amount of saliva after therapy changes, but also the quality of saliva. So we
Mhm.
really want to protect teeth. And the goal is to avoid additional dental treatment and avoid any possible extraction that if a patient receive radiation therapy to the jawbone specifically, there's the risk of a secondary complications that we called osteoradionecrosis. And I'm taking a little bit of a tangent here, but that's why we really want to protect the teeth, obviously to maintain function so that patients can eat, smile, and talk, but
Exactly.
also avoid surgeries to the bone and extractions that can lead to other complications.
Yeah, Ellen had a really good question over here. Going back to those the couple medications that you actually that you talked about, are there side effects to the two drugs that you mentioned? Because there's always side effects to anything we take typically.
Yeah, thanks for the question, Elaine. Yes, these medications, pilocarpine and cevimeline, have side effects. The most common is increased sweating because it also tells these medications tell the sweat glands to produce a little more, even though not everybody develop these side effects.
Yeah.
Some GI upset and flushing can also happen, and maybe go to the bathroom a little more often. But again, in general, these are relatively safe medications. There are some contraindication in a very small percentage of patients,
Mhm.
but in general, these are the most common side effects.
So ramifications if left untreated. I know we've talked a little bit about other things that this can cause, but ramifications if left untreated. My question is, when should I be concerned? When should I say, wait a minute, maybe I should be screened for this? What are those symptoms? What am I looking for to say, what's going on?
I think regardless of the symptoms, JJ, everybody who undergoes treatment for head and neck cancer should get followed up routinely because
Okay.
dry mouth can occur, but other complications can happen as well following
Mhm.
therapy. So
Mhm.
regardless of the symptoms, our recommendation and the guidelines recommend patients to always see a dental specialist regardless
Okay.
of whatever they're feeling in their mouth.
Okay.
And then the ramification of leaving poor salivation and dry mouth untreated and xerostomia untreated. Some of them we discussed earlier, candidiasis. We talked about cavities of teeth,
Mhm.
taste changes, but
Yeah.
dry mouth can also lead to mouth pain, especially
Mhm.
when there's very little saliva. It
Yeah.
can then lead to poor nutrition because of dry mouth. Patients may not be able to actually eat well and lose weight. So I would say these are some of the red flags to consider.
Okay.
And if left untreated, dry mouth, as I said, can lead to destruction of some of the teeth. And when we get there, we don't want to get to the point where the tooth cannot be saved anymore. Because as I mentioned, if a tooth needs an extraction and patients receive radiation to the jaw bones, that can lead to a more severe complication, which is what we call osteoradionecrosis.
And so another great question from Tatiana is, do you use oral probiotics in your practice?
Um, I personally don't use it. There are some studies looking at oral probiotics now in the prevention and treatment of what we call the early complications from radiation, which is mucositis. Still kind of like in the making in a way. There's some promising data. And then in general, oral probiotics and for dry mouth in patients receiving radiation therapy. There are some studies looking at the effect of probiotics and the pH in the mouth of patients, but they're not recommended for the management of dry mouth by the guidelines that I mentioned at the beginning of today's session.
Okay. Got another great question over here that people are on fire tonight.
Good.
Okay,
Go for
so
it.
is there a recommendation for use of an electric toothbrush versus brushing manually? This is important because we use a couple of different things. My husband uses a couple of things actually.
Yeah, I would say brushing and flossing and strict, we call it dental follow-ups, are the three most important things to prevent problems to the teeth in patients with dry mouth. Whatever feels more comfortable to the patient.
So it doesn't matter if
it doesn't
I'm just
really
going
matter.
old school or brushy brush.
The efficacy, if a patient knows how to brush correctly, the efficacy of the electric toothbrush and the manual is the same. If you struggle at brushing with a regular toothbrush, then that's when the electric toothbrush may help. One of the complications from radiation is also limited mouth opening. So in some cases, a small electric toothbrush may help to reach certain areas, but in general, the efficacy is the same.
Yeah, our speech therapist made sure that we did exercises, and I actually practiced with Jason so he didn't feel ridiculous. So we both looked ridiculous. And so we would be doing all of the exercises. He was very fortunate that he has that mouth opening was exactly where it was supposed to be. So my mouth was bigger than his, as he liked to laugh at me. And so I lost no functioning as well. So
That's a good way to do it.
Yeah, I mean, it's why not? I'm his caregiver. I might as well, instead of him feeling uncomfortable about it, because you're sitting there doing like, and so he had to make the noises. And so for all my speech and language therapists on here, they're probably laughing because they're like, yes, that's what we tell our patients to do because it's so important. That's an important component of getting through that process.
Yeah. So, Dr. Bill, I know we do have professionals on here, people that are definitely in your field. And then we have a lot of caregivers. And I'm a caregiver for my mom who has Parkinson's. But again, kind of that same effect where we're trying to do better with her dental health. Any suggestions for patients, for example, when Jason wasn't able to eat, we're struggling to make sure that dental health. Any suggestions on making dental care easier when you're working with someone who is not agreeable? How's that?
Well, and I'll say this, every time Jason tried to brush his mouth, it made him gag. And it was hard for him because he respectfully wanted to vomit because it was so hard for him to want to do that. So any tips or tricks that you would give to other folks who are struggling, who are in especially active treatment?
Yeah, during active treatment, one of the most challenging things is the development of mouth sores that can be very painful. Virtually every patient undergoing radiation will develop a complication that we refer as to mucositis. This is a time that is challenging also to maintain good oral hygiene. Sometimes what can help is before brushing the teeth is rinsing with I'll rinse with viscous lidocaine. So this is a numbing agent. So it numbs the mouth for about 15 to 20 minutes, but it may provide some relief while brushing. And we do this in patients, especially with bad mouth sores. And I mentioned earlier the prescription fluoride toothpaste, but there's also gels that can be applied to the teeth if brushing gets a little tricky during those times. There's also prescription mouth rinses of 0.2% sodium fluoride solution. There's creams also that can be prescribed that contain a good amount of fluoride, usually 1.11%. So there's different ways to kind of attack the problem and make sure that the teeth remain nice and clean.
Okay. All right.
So I see that there are two types of, Melinda's on here saying there's two types of fluoride in prescription toothpaste, stannous and sodium. Is one better for xerostomia than the other?
No, they're equally effective. There's different brands, different concentration. Typically, the concentration for stannous fluoride is 0.4%. It's available as a gel. And then the 1.1% sodium fluoride is available both as a gel, but also as a toothpaste. But in general, they're equally effective.
Wonderful.
We did have, go ahead. We did have a question about if you would speak to burning mouth. It's sometimes xerostomia results in a burning mouth. Is there anything patients can do to alleviate that kind of pain?
Yeah, that's a little bit what I was referring to earlier about the pain in dryness. The burning sensation can be caused by different things. Candida, which is the yeast infection that we talked about today, can cause burning. So one step would be to make sure that there's no oral candidiasis in the mouth. If that's ruled out and it's not a yeast infection, the burning can also be from damage to the nerves from surgery or radiation itself. Or there are also some cases of burning that comes from dryness or idiopathic, which is a fancy term that means we have no idea why there's burning. But in general, the treatment in acute phase is when it's like sharp and painful and it burns a lot is with numbing agents. But there are also other products available. There's medications that can be compounded as a swish and spit for burning, like clonazepam. More recently, we have started using also gabapentin. This is a medication that it's used for many other things, but it can be used as a swish and spit or even as a prescription systemic drug, all of which can help with the burning.
You know, Dr. Villa, and as a mental health professional, I was really shocked that one of the treatment regimen for his medications, for Jason's medications, was gabapentin. But you're right about the spit and or swish and spit. About the two, you said, was it?
Clonazepam and gabapentin.
Thank you, clonazepam. It was interesting that those two mental health medications are used as a way to do. I thought that was so interesting. And so there was a question earlier that I want to make sure I don't miss is antipsychotics can make your mouth dry all the time and cause cavities amongst about 1,100 other medications as well. I've been educated on that. And so, and there's no way to get off of them. So for people who are on, who have needs to be on medications like that long term, could that be causing a white coated tongue and the dry mouth because the tongue is white all the time no matter how much I brush it? That is what our person is asking.
Absolutely. And this is I think it's Michelle that was right. And yes, Michelle, you're right. Dry mouth can also develop from antipsychotic, antidepressants, some of the hypertension medications. There's a very long list. There's about 200 medications that can cause dryness, and some of the chemotherapeutic drugs that we use. In general, the treatment for dry mouth from drugs is similar to what we discussed tonight. And the coated tongue with more saliva and solid food can get a little better. But you can also brush with a soft toothbrush, different from the one that you use to brush the teeth, and kind of like gently brush the tongue, no more than 10 times. That can help a little bit remove some of the debris on the tongue. And then saliva. That's really what's going to help.
Got it.
Guys, I have one more question. And then if anybody else has any questions, we're getting ready to wrap up. We're at the end of our time. And I know we're over with Dr. Villa, but he's so wonderful. I want to keep asking him questions. So Dr. Villa, I know that the salivary glands can get burned up from radiation. That is my lay caregiver way to say it for my husband, because that's exactly what happened. The wet part, the watery part of his salivary glands got burned up. Is there any other treatments that anybody who has had this experience or dry mouth, is there any other treatments to restore that gland? Is there any way?
Great question. There's not available yet, but there's some studies now looking at what we call gene therapy.
Okay.
The phase 1 trial results were presented just a few weeks ago at the Oral Medicine National Conference, and now there is a phase 2 clinical trial open. Phase 2 means that this treatment is now being tested on a larger group of patients, and the study is open in 33 different sites in the US and in Europe and in Canada. So more to come, but that's something that may have the opportunity to restore the function of the gland.
Wow, that offers hope, is what I'm going to tell you.
Definitely.
That is
Yes.
very hopeful. I know that we've got some folks that are signing off. Dr. Villa, want to thank you so much for spending this time with us. I mean, honestly, your wisdom is just awesome. Thank you so much. Also want to thank our series sponsor, Coral and Phillips, who just joined in. Thank you very much. As well as our session sponsor, the Oral Cancer Foundation. And don't forget, everybody, I know folks are jumping here in just a second. We will send out the email for this session along with this recording tomorrow by lunchtime. It will have this recording. It will have all the CE information, and it will have our survey about this session, as well as next Tuesday's information. And so, and of course, it's not too late to sign up. Tell all your friends. Jay?
So next Tuesday on May the 7th, we have Joanne Jones with us, and she's going to talk about managing dry mouth, the side effects of medications and alternative therapies. So more things that cause dry mouth and more ways that we can work with those to hopefully eliminate, maybe make it a little bit easier, Dr. Villa. We're trying to figure it out here. So, but yeah, we hope you guys will come back and join us next Tuesday with Joanne.
All right, guys, thanks so much. Daniel, we will post the link for the YouTube video. Happy to send that to you. Daniel, if you'll put your email in the chat, that would be great. Guys, thank you so much. We appreciate
Thank you, guys.
Thank you for having me. Have a good night.
Thank you, Dr.
Bye.
Villa.